Good evening. Today is Thursday, March 27th. I will officially call the North Andover Board of Health meeting to order. We'll start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we have our last month's meeting minutes. Anybody approve, or anybody review them and approve them? Okay, so I'll take a motion to approve last month's minutes.
I second.
All right, all in favor?
Aye.
Okay. Approved.
I reviewed them before.
There we go, perfect.
Unanimous decision.
Unanimous. New business, variance request from Brookside Homeowners Association for a 3-year lifeguard variance. And it's dated for March 6, 2025. Brian, you want to just,
Yep.
I know we've talked about this in the past.
Yep, they get it every couple of years. Carolyn is here. She's been working with them on this in the past, and they're also here to discuss it as well. If you guys want to state your name and who you are and go through it.
Yep, my name is Catherine McRae. I'm a board member at Brookside. I live at 624 Chickering Road. As you know, since 1989, the board has granted us a 3-year lifeguard variance, which we have greatly appreciated. We have 3 residents who are CPR certified. We have our pool rules printed on a large board right at the front of the pool where everyone can see. We also send a census to all our unit owners each year in the spring, which includes our pool rules that are required to be signed and returned to the board by all unit owners prior to the opening of our pool each year. We are contracted with Lenny Anolaro, who opens, closes, cleans our pool, maintains our water testing and balancing. The board members also, at various times throughout the day, take water tests also to make sure the levels are appropriate for our swimmers. Our community looks forward to the pool every year and gets much use and enjoyment by the residents. And myself, on behalf of the board and the Brookside residents, thank you very much for the opportunity to request another 3-year variance.
Doing that, Carolyn? Okay. Yeah, they've gotten this in the past. They have a very low number of owners over there, so the cost was very prohibitive to split up a full-time lifeguard for the entire summer by, what do you guys have,
29 units.
29 units. So it was thousands and thousands of dollars per unit. So it's been a hardship for them that we have taken up in the past, and we don't have any issues with.
Yeah, only one question. Do you have any signage posted, just letting folks know there is no lifeguard, no one will come
It
to?
says no lifeguard, nobody can swim alone, there has to be 2
Yeah.
people inside the pool area at all times. All of our pool rules, we also have signs that no glass. Am I missing any other signs? I believe that was everything, the no glass, our pool rules. Yeah, the gates are locked, you have to have a key, you have to be a unit owner, you have to be a resident with a key to get in and out of the pool. We've got, the signs are all up there.
Have there been any issues?
We've had no safety incidents to date.
Anybody have any concerns? Is there a motion?
I move that we approve the request as so written and requested.
Second.
Second.
All in favor?
Aye.
Aye.
Okay.
Thank you
Motion
very much.
passes. Look at that.
Easy to
Easy, easy.
Thank you guys for coming in.
Thank you, guys.
Thank you.
Communications, announcements, and discussions, PHE update.
Yes. And that is so kind to grace us tonight and give us a full update about the PHE grant, which has been going extremely well. So.
Yeah, thank you all so much for having me. I'm happy to be back here. I know it's been a while since I've been here, so we are continuing on with the grant. A few numbers to throw out there. So since Shanine joined us in August of 2024, she's performed 206 inspections across the 6 communities. We are almost at the end of Q3, so since January to March, she's completed 54 inspections. Year to date here in North Andover, that equates to about 40 inspections that she's helped with. that includes, I think North Andover has the biggest variety of types of inspections that she's completed. So she's done food, pool, body art, I think she's done, some housing inspections. So she's kind of helping out all across the board. I know she's been out with Craig a few times to help with training. I think they're doing some mobile food training on Monday. So that's been great to have that support to really get Craig up and going. And she's certainly been really busy with doing those inspections and thinking about how we can standardize inspectional services across all of our communities. So that's been very successful. Our public health nurse has been working on a lot of different training opportunities. So in January, we held a Narcan training of the trainer. So we partnered with Health Resources in Action, and they came and taught all of the public health nurses across our collaborative how to offer opioid rescue training to residents, staff, any stakeholders in town. So it was a really great opportunity to bring all of those folks together to learn the material and also think about how you do adult education. And since then, we've hosted 2 additional meetings with that group of individuals to talk about what type of, opioid rescue, Narcan training are you doing in your communities? And I think it's served to be a really good collaborative space for all of those stakeholders to come together. We're hosting another one in April here at the fire department, and we're hoping to include more than just our health department staff. So who else in town is working on those types of issues and programs, and really creating a space where everybody can come with their experiences, share best practices, think about additional ways that we can collaborate across communities to ensure that we're being really effective and efficient with our resources as we do opioid outreach. So that's been a really successful initiative. Our public health nurse also continues to help our communities maintain 100% MAVEN coverage. So MAVEN is the disease investigation tool from the state. Any reportable diseases go through there, and then the local public health nurses follow up with the individual to do case investigation, offer resources, and any advice that they may need if they have to stay home or follow any course of treatment. So she helps provide coverage when local public health nurses are out, or if there was any outbreak, she would provide support. But it's been really successful in having her ensure that there's always that backup coverage if somebody's unexpectedly or has a planned vacation. To date, we've completed 50% of our work plan items. So that's excellent. We're definitely on track to complete all of them by the end of the fiscal year. Most of our work plan items left are things that are ongoing. So the MAVEN coverage, the inspections, continuing to offer training opportunities for our inspectors and nurses. So it's been a very successful year in that respect. And then I think our biggest project that we just started is we're undergoing a strategic planning project. So we contracted with BME Strategies, and they're working with us to develop a 5-year strategic plan. So this process just began in February, a few weeks ago. I guess it's the end of March, so a month ago. And we're meeting with them monthly, our advisory board and our shared services staff, for 2 hours to kind of brainstorm and think about what we want to achieve in the future. They're also going to be conducting key stakeholder meetings with all of our local health departments. So that may include you as well as our Board of Health, some key stakeholders here in North Andover. We really want to hear how we can support the work that's being done on a local level and not have the presence of like the shared staff skew the type of feedback that they're providing and their wishes. So the consultant will be reaching out to schedule those meetings, and hopefully you all will have a chance to kind of meet with them and share your experience hearing from both Brian and myself of what we're working on and what you hope that we can help North Andover achieve within the next 5 years. So I think those are like our really big updates, our important things to share, but I'm happy to answer any questions if you have specific things that we've talked about in the past that I missed.
Sounds like a very positive report.
Right. Yeah, it does. Yeah, it's going well, so that's definitely good.
Any luck in the mobile food program that you guys are working on?
So what we are working on, and I actually just talked with Shanine about this yesterday, is that And I think we've done it ad hoc as mobile food applies. One of the things that we often see is that they're applying for permits across multiple of our communities, and each of those inspectors are performing an inspection of that mobile food unit, which seems really redundant. So what we've done so far is just like on an as-need basis. Shanine is performing inspections, and she performs one inspection on behalf of all the communities that that mobile food unit is operating in. And so going forward, as you know, more trucks are starting to apply, it's getting warmer and their events are coming up. What she's planning to do is schedule a handful of days in like 2 or 3 hour time periods, and essentially inviting all mobile food trucks to one location that she can perform inspections. And she's gonna, you know, get a list of what communities are you planning to submit a permit in, and so that she can forward that inspection report to those communities and they can waive their local inspection requirement. So it's a really great way for us to utilize that shared resources. Everybody's comfortable with how she performs inspections. It also helps ensure that they're standardized across the communities because she's doing them for everybody. So I think that's going to be a really great resource that we can add this spring, and reduce the burden on the local inspectors for doing those mobile food inspections.
I've done it for years. It's finally coming to fruition, which is fantastic.
Very convenient for food truck people too.
Yeah,
They've
absolutely.
been saying that for years too.
Makes sense.
But it's hard when you have different health departments and different inspectors and different boards that may have differences of opinion, different standards, not that they're supposed to, but we're always required to do it by ourselves. And so we'd have Craig set up 15 food truck inspections in the spring where he could be doing other things, or we could be spending our time doing other things versus tracking them down, scheduling it, meeting with them, doing the inspection, and then they're off to the next town to do the exact same thing. So I've been looking forward to this for a while. Anything else you can think of?
You were speaking and I thought of something else that I was like, oh, this would be a good one, and it left my brain. We're working on planning some trainings for all the staff across, so some additional trainings. We're going to be offering a mental first aid health training, mental health first aid. That was a tongue tie, in May. And so that's a really great training for both our inspectors and our public health nurses, because as inspectors, when you're doing housing inspections, you often are working with folks who have mental health impacts in their life, whether it's themselves or their family members. So having that training to learn how to identify somebody who's in a mental health crisis, you are more familiar with what types of resources you can connect those individuals to. It really creates a holistic picture when we're going in as inspectors, and we can treat not just the housing concerns, but we also can connect folks with other resources that may be beneficial. So our public health nurses help us put that together, and that's going to be excellent. We are working with a food consultant, and we're hopefully going to be planning a special processes training, so teaching our inspectors how to identify special processes in food establishments like reduced oxygen packaging, sous vide, smoking is a really big one, like smoking meats and cheeses. Sushi is another special processes, so this will add some more specific training about how to identify it and then what components an establishment needs to be successful with that. So talking about their HACCP plan and helping them, you know, build that and go through the right steps to get any variances that may be required. We are also planning a Stop the Bleed training, and those are great trainings because once you take it, you become a trainer. So anybody who takes a Stop the Bleed training can then go out and teach their town staff or their town residents how to do Stop the Bleed as well. So that's going to be a great resource and really help build capacity at the local level. I think those are, we got a lot coming. A lot of those are going to be in next fiscal year, but something to look forward to.
All right.
Excellent. Thank you.
Thanks for that.
Yeah.
Inspector update.
Yes, not a huge update. Been really busy with doing a lot of the residential kitchen inspections, and also a lot of the churches and the stuff, you know, the places that aren't, you know, full-time and crazy, because I know that the pools and food trucks will be coming up. So trying to get a lot of those inspections done before that busy season kind of ramps up. Also, since last time, just been taking some more trainings and workshops, which have been really helpful, especially being new. We just took the emergency preparedness workshop, which I found to be very helpful. Just, again, being new, it's a lot of new information, so I thought that was very helpful in terms of just learning some new stuff. Definitely a few more trainings coming up. I got the Tier 2 food one coming up in June, I think, which is a five-day course, which will be great to kind of get under my belt, which will be nice. A few hoarding situations that we're dealing with. One's kind of coming to a resolution. One we just kind of in the process of trying to get our hands around. So working on that. And yeah, just been out there trying to be more involved in picking up some more inspections, just, getting more comfortable with the software and the whole process, just, kind of taking on more as it comes.
Excellent. Carolyn?
Camp season is starting. So we have this year, I think, so far, 5 new camps coming into town.
Oh, interesting.
So we're trying to get them up and ready to go for the summer.
Is it all at Brooks?
I hear 3 of them are at Brooks, on top of the ones that Brooks already has. But Brooks has a beautiful facility. So we're doing camp season. As Annette mentioned, I got trained to be did the train the trainer for a Narcan class. We're working on the application so we could receive Narcan and distribute it to our communities. I am a CPR. I can teach CPR now, so on top of that, hopefully we can get people CPR trained, Narcan trained, and kind of help out the community there. Doing blood pressures at the senior center. We have a handful of foodborne illness outbreaks that we're following up on Maven right now. Luckily, none of them seem to be town related. A lot of them are travel related, which isn't great, but still nice that it's not coming from town restaurants. We're just working towards kind of some of our spring and summer events to do in the community.
Excellent.
A couple of questions as always.
Couple of answers.
The first, are there any identified tranches of funds or anything, just given, I heard that, I'm always on the news, and in the news cycle, I just understood that there was going to be some clawbacks of funding that was supposed to be allocated towards different types of disease prevention and things like that. Is there anything on your radar that you're concerned about or seeing?
Nothing on my direct radar. We just finished our application to be a VFC site so we can receive childhood vaccines that we can administer to children for free. We got approved for that. So nothing directly affecting us currently. That's not to say that that's forever.
The only other question I had was more, I think you sort of addressed it before, but I understood like the first cases of measles were being picked up within the state.
Yeah, I saw that that train
Yeah.
had a guy. Luckily, still no alerts of measles in North Andover. Again, that's just now.
We
That's
gotta
not
eradicate it.
forever, but I'm hoping it's forever. But again, in Massachusetts schools, they are required to have a set of vaccinations before entering schools. And we do provide, if a child isn't vaccinated for measles, we do have the opportunity through the VFC to get them vaccinated.
Thanks.
Brian?
I think I've heard some rumblings about CDC cutting funding to the state, not necessarily all of it, but a portion. I haven't gotten a total or an amount, but there'll be some trickle-down effect, I'm sure. We just have to redirect our resources and allocate it to what we think is best, obviously. But we'll play it by ear. So we're hearing stuff, but nothing concrete. We're still waiting for our award, if we ever get it, for the round 2 of the FDA grant that we started this past year. We're supposed to hear in January. We haven't heard anything yet, so that's still in limbo. So we'll see what happens with that. I'm sure after the after all the pieces have been moved around and things have been shifted, and they'll start to figure out where things are gonna go. All right, so, let's see. Quick update on the artificial turf field discussion. We just got this request this past week. I know I sent you guys the information. We don't have to have a long drawn-out conversation about it tonight, but I gave you the minutes from the last meeting back in 2019. I gave you the memo that we wrote and sent to the planning board, who was doing the site plan review for the rec complex back in the day. Now they're doing it for the high school and the new field setup they want to do over there with expanding the existing turf to cover the baseball field and the grass field that's there, and make it one whole turf surface with baseball, softball, football, and then obviously lacrosse and soccer and everything will be able to use that. So right now it's in the infancy stages. They sent a report from Arlington that they did last year. You guys get a chance to read it. I gave you the EPA report, which is a lot more robust. It's also 211 pages, so I didn't need to read it yet because we just got it. But I'd like to discuss at least the small report that we got from Arlington and get your opinion. You guys get a chance to read it, which is good. Pretty basic, pretty straightforward. It wasn't very scientific. They did look at a lot of different things to draw information from. But they did use like newspaper articles, magazine articles, some studies, some nonprofit studies, things that give you information, but it's not necessarily scientific per se. It's just, it was subjective and opinionated for the most part, but they came up with conclusions that you would kind of expect. They talk about the different issues like the heat stress issues and what that comes down to in terms of temps. Nobody's disputing that. I think that's been a known issue with artificial turf fields, is it does generate more heat than natural grass. No evaporation, transpiration, things like that. Black prem rubber obviously has a contributing factor to that. And then they talk about skin. Obviously, there's less bacteria on ATFs than grass fields, but high abrasions can be handled with good hygiene. They go into that for a page or two, which is basic, straightforward stuff. Injuries, they talk about injuries. And I remember looking at this a few years back. The research they did concluded that there may be an increase in ankle and foot injuries, but it's more at a collegiate and professional level than it is little tykes running around. They actually determined and found that concussions were less. I didn't check their sources on that, but I don't know if it's just the populations that they looked at, or if just helmet technology in football got better over the years. I'm not really sure about that, so there's no...
Or just practices.
Yes, yep. So, they doesn't have scientific to back that up, but at least that's what the numbers state, which I thought was actually very interesting. Then they talk about the chemicals. This is where the report gets very subjective and starts making assumptions. So, which in any non-professional report, you have people and you have their opinions and you have their thoughts, which is fine. That's what the purpose of was for them, for their situation in Arlington. But there's no data reflecting exposures mentioned in the Arlington report. It also gets into then after that, after the chemical issue, they talk about stormwater management, climate change, cost comparisons, field maintenance, both natural and artificial. And basically the committee opposed an outright ban. And they basically said it should be an option with conditions. And I think there are some conditions that we talked about a few years ago. Your typical standard stuff. Look for alternative infill.
The brown versus the black.
Yeah, to reduce the heat, or some organic. There's call it coconut, which is probably a coconut-based infill. And I don't know what the costs are in any of these, and we can talk about that at the next meeting. But just in general, they talk about the different mitigating factors you can look into to try to alleviate some of the concerns that people do have. But in looking at that report, it was good. It was very, informative. They also did talk about looking at each individual field on a case-by-case basis, which is, I think, where we're at this point. When we looked at the Recplex 5 years ago, 6 years ago, we can look at this one coming up now, and we can put it on the agenda for next meeting. If people want to speak, they can speak, but at least you guys will have time to review both reports and look at the EPA report. That's actually pretty legit, fully scientific, where they have your methodology, they have your scientific, this is completely unbiased.
It was a study.
Yes, yes.
It was a study.
And I appreciate that they went through and looked at all different sources. Yep. But yeah, the EPA report, I know you started to look at already.
We're talking about there was like European studies in there
Oh, yeah.
too.
Yes. You know what's funny, when I looked,
They did a lit site.
Yep.
yeah, when I looked at the information back in 2019, one of the things that stuck out to me was people are concerned about VOCs and PAHs because it's in the crumb rubber, so therefore there's a potential exposure. Granted, the pathway isn't quite there, but they did take measurements in Italy. They set up air monitoring stations around a couple of fields, and it was funny because the highest concentrations in hits were at the meters only along the roadway. Traffic,
It
cars.
was just the whole point I was making earlier.
Yes, yeah, right? So, there's a lot of research that still needs to be done, but I think if we can absorb this over the next month, we can talk about it at the next meeting. You guys can come up with a formal opinion. We could do another memo and letter. I honestly don't think it's gonna change very much. If you guys read that, it's pretty relevant to what we've been seeing today. But the planning board did request you guys talk about it and come up with at least an opinion.
Do you have a copy of the memo we did in 2000?
Yeah.
Oh. Oh, there, I got it.
There you go.
Just so we know for,
Any questions, any
All
comments?
the same conclusions that all the other ones.
yeah, I mean, I remember I'd have to go back and just read this and see what, recall my memory of what it was. And I think it was like month number 2 or 3 on the board at that point.
You're green.
I know, I don't even know if I spoke at all. But I mean, I actually read the EPA study too, and it was a legit,
Yeah.
robust
Right.
study.
And that's what we were waiting for, basically.
Yeah. Okay, so we'll plan to put it on the agenda for next month.
Okay. I know, yeah, they're going through the site plan review now, and they asked for it literally last week, and I was like, oh, this is coming up again. All right, great.
The interesting thing is a lot of times when you read those studies, they're even more mealy-mouthed about, well, it could be this, could be that. It was actually more strongly stated than I expected them to come out. But
So I expect next month a full crumb rubber breakdown from our subject matter expert.
I'll bring charts.
We can do PowerPoints, that's fine
There
too.
you
But yeah, next month we'll get into some of the details, look at the big report, and I'd definitely love to hear about your experience with tire manufacturing.
Yeah, just for the public record, my first job out of undergrad as a chemical engineer was at Goodyear Tire and Rubber Company, doing polyisoprene, polybutene chemistry along with the Nalax, which is carbon black that goes in the tires.
So yeah, so we have an expert on staff, I love it.
Relative expert.
All right.
I think we have to just look at the next month's meeting and see who's gonna. I think it's spring break weekend.
I think we changed it to the week before
Okay.
vacation. Because
We officially changed it. Okay. Perfect.
Yeah, it's going to be is it the 17th, 17th?
Okay.
So the week before we all leave for vacation. All right. On top of that, we did include a first draft of the food reg changes. Those are just the changes. Those aren't incorporated into what we already have.
Oh, I did.
Oh, you did?
Did the incorporation. So
Oh.
the underlined areas are the updates, and anything not underlined are your current existing food regulations.
You had time to do that? Nice job. We literally talked about it this morning. Yep, so that's, so I'm gonna add some more changes to it that I have in my ongoing file that I've been doing for this, that I wanna add in myself. But that's for, we could do it next meeting, I can get you a another rough draft of it in the very near future, or if you want to just do the rubber discussion, I can wait until the following month, but I'd like to get that done sooner rather than later. Okay. Any questions, any thoughts?
No.
I think the biggest change is going from the required 2 inspections per year per establishment to a risk-based schedule. So some things will be done 4 times a year. Some places will be done 1 or 0, depending on the risk-based. I mean, your snack rack at a gas station, very low risk, obviously, versus a full-service restaurant with sushi or a highly susceptible population like assisted living, it will be done obviously more frequently.
I think one of the other big changes is the adoption of the most recent food code.
Yes.
So within there, we included automatically adopting the most recent federal food code. And so what that would mean right now for North Andover, you're on the 2013 food code. And you'd be jumping up to the 2022 food code, which is the most recently published. And there's a few kind of large pieces in there that will impact restaurant owners, and the biggest one of that is that currently only one person in the establishment needs to be a certified food protection manager, but in the 2017 food code they require at least one person on shift to be a certified food protection manager. So that means they're going to have to do additional training for staff to ensure there's always somebody in the building that has that certification. And I think internally we can look at that FDA grant to help support, because that's obviously a financial burden on the food establishments. But I think other communities have gone through this already, and they've come up with some creative solutions to help kind of ease that burden on the food establishments.
What kind of program is it? Is it like an online?
So, no, it's usually a trainer can go to them, or we can host it and have 50 people take it all at once and have a trainer there.
Okay.
But it's a course and a test.
Okay.
So certified food manager.
But yeah, those are probably the two largest.
That and the allergy on the menu. Is
Yeah.
a big one.
Yeah, they have to, in the 2022 food code, there's some new allergy requirements. So currently they just have to let your server know if you have an allergy. In the 2022 food code, they have to list each individual allergy for each menu item. So we've come up with, I was working with Linfield as part of the PHE grant, because they just went through this change, and we've come up with a few good examples that food establishments can use, and they've given their food establishments basically a year and a half to come into compliance, because they order menus by the thousand, and it can take a lot of time to go through that stock. So it's definitely something that we'll consider as a rollout and helping provide education to food establishments and guidance on how to update the menu. But that's certainly another one that has some financial impact.
How do you designate, somebody could be allergic to lettuce?
That's
and
exactly where I was
so
about to go.
The FDA has
There's
their
been like a top 10 or
allergies.
something
Yeah.
like that.
Yeah.
Top 8.
I think it's 9 now. They just
It's not-
added sesame. Yeah.
That's right. They just added sesame.
So
too.
it's the ones indicated by FDA of the big 9 allergies. So it's not like everything that somebody could be, but those main ones that when you think of allergies, you're like tree nuts, peanuts, sesame, soy.
Sesame. Yep.
Yep, that's the new one. Yeah.
So yeah, I'm actually looking forward to that. We've been talking about that for a long time, and literally the 2013 code. That's what we're on for the FDA code. It takes Massachusetts forever to adopt the new one, and the FDA comes out with them every 2 years, 4 years.
Yeah, so every 4 years they come out with an official, and then every 2 years in between they have a supplemental that they'll just make very slight changes on.
Yeah. So we'll be up to date finally. Yep, and we should be starting trash truck enforcement any day. We finally got our sign printed up and installed at the end of Holt Road, which basically tells the trash trucks you can only go left, not right. Most of them are permitted. We have a few that haven't picked up their placards and permits yet. But they've been given notice by TVA and Wheeler Brader. We've had the signboard out. We just installed the new sign. That's a hard fix sign down there. They all know it's coming. So they're going to start getting pulled over real soon. And we can start getting a handle on where they're going and where they're not supposed to go. 'Cause that's been an ongoing issue since it started back in 1990. So, fun stuff, right, Craig?
You need to hire somebody with the arrow,
Yeah.
twirling the arrow. Word.
Overtime pay?
Yeah, overtime pay.
Excellent. We're going to be putting out the AEDs in the next week or two. I talked to the fire department about that. Things are starting. Lacrosse is starting. Soccer's starting. Kids are outside playing.
This is only because I'm also on NASA's board.
Yep.
There were a couple, it seemed like vandalism incidents, primarily around Carter Field.
okay.
Just some concern about how that, maybe that's a discussion at some point that we brought, obviously not to this particular board, but there is some concern about that, and it'd be interesting. I guess it's not the purview of this particular body, but yeah, just some concern about how best to protect those fields.
The fields themselves are the AEDs.
Well, someone saw fit to take an ATV and basically run onto the field and basically tear up all the grass. So it's not a leap to say that they could vandalize the
Right.
AEDs or anything
Yep.
else. But,
AEDs are on 2 4x4 PT posts cemented in the ground. So if you hit that with an ATV, you're going to hurt
yeah.
a lot more than just the post. Sharpner's Pond last year, a car did donuts out there and destroyed the baseball field.
Yeah.
And the kids are going to play baseball the next day, and it's like, oh, can't play here. So, ongoing issue. Young adults,
It's a
teenagers.
shame.
Yeah. So, all right, good to definitely think about. Cameras.
Yeah. That got too
Right.
serious. I'm sorry.
That's all right.
Just twirl the arrow again?
And it's funny, I actually, we're partnering up with Tony as the trash guru in town now. We're going to sponsor a double barrel at one end of the overpass by McDonald's. Big littering issue over there, obviously, going back and forth and kids being kids. Going to do a double barrel on each end, recycling and trash, and maybe some signs that hopefully will help people not throw their stuff on the ground. We'll see if that happens. Also looking at doing some replacing all the trash bins around the common. Those things are like 15 years old. They're rusted out. They're terrible. And I'm trying to talk them into doing some doggy stations as well.
Oh, yeah.
It was Larry Fixer brought
See
this
a lot
up,
of
who was a board member here. Yeah,
Yeah.
he was a board member for a long time. You remember Larry, right?
No, I think I replaced
Oh,
it.
okay, yep. So Larry wanted to do that years ago, and the historical commission or the people, the powers that be, didn't want to start pushing that just yet. So I think maybe now might be the time. A few years later, I think people see dogs there every single next
Yeah.
day.
Yeah, I think it's accelerated, if anything.
Yes, absolutely. So I might try to sponsor one of those and get one of those and have DBW put it up. We'll buy the bags and everything. Just if it helps people.
Probably need one on like opposite ends.
Well, people park on the Osgood Street side right there.
Yeah.
So if they're there and they get out of the car and there's a station there, they, oh, I forgot my bag. I'll grab one.
And then put it in the trash.
Yes. That would be a really good thing. Yeah, so we'll see how that goes. That's in the infancy stages now, but we talked about it, and I met with the DPW on that yesterday about doing those, and they're all on board, so. Yep. And that is it. That's all I have for updates. And then just typical day-to-day activities are going strong. Greg has been actually a very fast runner.
Doing what I can.
Yeah. So he's hit the ground running and he's doing a great job. So, I mean, you guys all are fantastic, but he's the newbie. Any questions? What do you guys think?
All good?
Move that we adjourn the meeting.
All right.
I'll second that.
All in favor?
Aye.
All right, meeting adjourned.
All right.